Postnatal care of mother and baby. The days and weeks following birth are a critical time in the lives of mothers and babies. This video covers key recommendations to help a mother care for herself and her baby after birth. Be sure the mother and baby are both doing well before discharging them home. Provide care in the facility for at least 24 hours after birth. Then examine the mother. Check that her blood pressure, pulse, and temperature are normal. Her uterus is firm, and her bleeding is minimal. Talk to the mother about changes in her body. Teach her how to check her uterus. It should feel round and hard. If it gets soft, have her rub her uterus until it's firm. For the first 3 or 4 days, she should bleed about the same amount each day as a monthly bleed. Then her flow will lighten. After a few weeks, it becomes light yellow, then gradually stops. If she is too active, her bleeding may restart. Advise that she rest, and if the flow doesn't slow down, she should seek help. Now check her baby. Be sure he appears well, is breathing easily, and is breastfeeding well. Now prepare the mother and family to care for the baby and mother at home. First, counsel how to care for the mother. Talk about how she can regain her strength. The first few weeks with a new baby are very demanding physically and emotionally. Encourage the family to help with household work, preparing meals, and helping with the new baby. Have the mother rest with her baby and try to sleep when her baby sleeps. A variety of nutritious foods will build up her strength and her milk supply. Then talk about sex. Explain that it's safe to have sex again once the mother's bleeding has stopped and she feels ready. Advise the new parents that it's healthiest for the mother and baby if they wait at least 2 years before getting pregnant again. Tell them about which family planning methods they can use while the mother is breastfeeding, including condoms, the IUD, the implant, and progestin-only pills. She can start injectables at 6 weeks postpartum. If they have completed their family, tell them about permanent methods. Breastfeeding will usually protect the mother from pregnancy for about 6 months if she is feeding her baby only her milk and her monthly periods haven't started. If possible, supply them with a birth control method before they leave. Now, teach danger signs after birth. Heavy bleeding. She's bleeding too much if she soaks 1 or more pads in an hour or her bleeding is increasing. Fever and weakness, plus a bad odor from the vagina and pain in the abdomen. She may have an infection in her uterus. Severe headache or vision problems. She may have a dangerous condition called preeclampsia. Convulsions. She may have progressed to the life-threatening phase called eclampsia. Swelling, redness, and pain in one leg may mean a blood clot in the deep veins of the leg. Fast breathing could mean the mother has a blood clot in her lung. Severe abdominal pain is a sign of a number of serious problems. Severe sadness and anxiety. The woman may feel so sad that she cannot care for herself or her baby. This doesn't mean that she doesn't love her baby. The hormones after birth can affect some women emotionally. Advise the family to bring the mother right away if any danger sign occurs. Now, teach about care of the baby. First, talk about feeding. Show the family the baby's feeding cues. Putting his fingers in his mouth and turning his head means he's hungry. Feed the baby whenever he's hungry, as much and as often as he wants, at least every 2 to 3 hours, day and night. Be sure the mother feels comfortable breastfeeding. If the baby is not well attached, show her how to improve the position and attachment of her baby. Advise that she give her baby only her milk for the first 6 months. No water, sweetened water, tea, honey, formula, or anything else. Advise the family not to put anything on the baby's cord and keep it open to air. They should wash their hands before caring for the baby. There is no need to wash the baby every day, but they should keep his face and bottom clean. Talk about keeping the baby warm. Advise they dress him in an extra layer of clothing and a covering on his head. Recommend that the baby sleep on his back or his side, not on his belly. Keep the young baby away from smoke. If malaria is common, recommend using an insecticide-treated bed net to prevent malaria in both the mother and baby. If the mother has HIV, be sure she gives her baby ARV medicine to protect him from becoming infected. Next, teach newborn danger signs. Fast breathing, chest indrawing. The chest draws in with each breath. A cold body temperature. The baby's belly and feet are cold compared to their own. A hot body temperature. The baby's body is hot to touch. Not feeding. The baby doesn't act hungry and may not wake up to feed. Lethargy. The baby only moves when stimulated. Convulsions. The baby may have unusual eye or mouth movements or repetitive jerking of the arms or legs. If any danger sign occurs in the mother or the baby, advise the family to bring them to the health facility right away, day or night. This could save their lives. The mother and baby need checkups, and the baby needs vaccines. Recommend that they go to the health center 2 to 3 days after the birth, between 7 and 14 days, and 6 weeks after birth. Remember, a mother and baby can be discharged when they're both well, have stable vital signs, and the mother's bleeding is normal. Talk to the family about supporting the mother letting her rest, and making healthy meals for her. Prepare the mother and family to care for the baby by discussing feeding, warmth, and danger signs.